Good afternoon, good morning, everyone. Welcome to Gentry's Journey. And our guest today is Dr. ChiChi Ezel. And she's going,
Ezeike,
EJ?
Ezeike.
Ezeike. I beg your pardon, Ezeike. But she is a physician, and she's going to tell us about how she discovered that's what she wanted to be, what she has accomplished, and she's going to end up telling us about her wellness journey and what she does with wellness. So, Dr. ChiChi, we do appreciate your time for coming on to Gentry's Journey to speak with the audience. So, you have the floor. Thank you.
All right. Thank you, Ms. Coleman, for having me. I really appreciate your time.
Thank you.
So just like everybody else, that come on your podcast, I'm sure that they have, great time. So I'm looking forward to having a great time with you. Well,
Absolutely.
first, first I wanted to, introduce myself. My name is Dr. ChiChi Nwankwo Ezeike. I was originally born in Houston, Texas. I grew up in Nigeria. So that's, where the accent came from.
Okay.
All right. So after, staying in Nigeria about 17 years of age, I graduated high school. My parents decided that I needed to go back to my place of birth. And so I came back to Houston, started undergrad at Texas Southern University. And I was actually studying pre-pharmacy, but it was not really my heart. I wanted to go into medicine. And so, as I'm talking to everybody else, all my friends are either doing pre-pharmacy, or they are studying biology to go to medical school. So at that point, I decided, that I wanted to join Navy. Had no idea what Navy was all about. I have no idea what the military does, except in my mind they go to war.
Mm-hmm.
That's it. But you know, I the idea was for me to leave Houston, but I just didn't know how to leave Houston after being there for about 2.5 years.
Mm-hmm.
So I got an undergrad internship at University of Michigan, Ann Arbor. So I went there, I did the research for the summer. I enjoyed it. I was like, man, I love this place. I wanted to leave. And so when I came back to Houston, the whole idea of leaving just keep, nudging on me, but I just don't know. I mean, a 19-year-old, 20-year-old, I have no idea how to start packing up to leave.
Sure.
So I went to the mall one day. I got off after school. I went to the mall just to, just browse around. And I saw some pictures. And I'm looking at these pictures and I see pictures of military people. And, you have the Navy, the Air Force, the Marine, the Army, the Coast Guard. And I'm looking at them like, man. So I kept trying to imagine myself, wearing the uniform. And the only one that really suit me well was the Navy uniform
That's
in my
great.
mind.
Mhm.
So I walked into the office and I'm looking at the name, on the door, and I saw the Navy. So I walked in, I said I wanted to join the Navy. And they were like, and they're looking at me with my long hair, like all little decked up girls saying that she wants to join the Navy. And the guy was like, you should go think about it and come back. I'm like, no, I don't want to think about it. I
Mhm.
just want to sign up. So I
Mhm.
signed up you know so after I signed up, to join the Navy, I took the first test, I passed it, and he said, okay, go home, come back and take the second test. I said, no, I want to take the second test now. So I took the second test. And
Wow.
so anyway, long story short, that's how I joined the Navy.
That's great. Well, one thing for sure, you knew what you wanted.
I know, right? I
Yeah.
wanted to wear the white uniform.
Yeah. They couldn't sway you not to join. You did that because
Yes.
that's what you wanted to do. That's a
So
beautiful thing.
yeah, so I joined the Navy, and again, I didn't they asked me, okay, what kind of job do you want to do? And I was like, I wanted to go into the medical field. But at the time, the medical field was closed. So they were like, okay, we have another job for you. So they, told me I'm going to be a supply keeper. I have no idea what supply keeper was, you know. So I joined, got there, got to boot camp, and of course, after the whole it was actually in boot camp that I called my parents and told them that I joined the
Oh,
Navy.
wow. They didn't know.
Yes, and they did not know. So my dad was like, "What do you mean you joined the Navy?" So he thought that I'm like, maybe working in the Navy as a civilian. I'm like, no, I joined. So he was like, wow. But anyways, at the end of the day, I finished boot camp, went to A school, and then I got stationed in Pennsylvania. So it was in Pennsylvania that I was like, my passion of being a doctor, this is what I'm going to pursue. Now
Mhm.
that I'm outside of Houston, outside of kind of like my comfort zone, I
Sure.
need to start pursuing my own, dream. And so that's how I went in and I enrolled as a biology student. So it just happened that by the time I was graduating from biology was the same time that I was finishing up with the Navy. So I finished my 4 years of, service. I went to medical school in the Caribbean. I did 2 years in the Caribbean and then came to Chicago and completed my last 2 years. And, that's where my life as a medical student or as, a doctor started. And, of course, in the process, I got married. And so while I was trying to apply to residency, I moved to Canada because at the time my husband lived in Canada. So I moved to Canada with him. And so I was, studying for my board exams and also applying for residency. And it kind of, became a lot, and as far as it's not too kind, quote unquote, to say, the residency wasn't too kind because at the time it's almost like, as a foreign graduate, it was a little harder to get into residency. But, as God will have it, and I think, during that time, even though I was, a lot depressed because I went to medical school and I'm like, I really love medicine. I want to be a doctor. I want to help patients. I came across a friend of mine that was like, hey, join this Facebook group, it's a physician, face group, and maybe tell your story there and see if somebody will help you out. And so when I joined them and I started, hearing stories about them and as a physician and how people are burnt out, people are, dying, divorce is on the, horizon. I was just like, hold up, this is not what I signed up for, you know. So it gave me a different perspective as far as medicine is concerned. And so I now started changing my prayer. So my prayer now wasn't, God, I really want to get into residency. My prayer became, God, what is the next step? What do you have in store for me?
Sure.
And, so from there, I started teaching, and I started loving, teaching. I went into research at first. I did research for about 3 years. And, from there, I started teaching, college students. And, and ever since then, I've been in teaching, So from the teaching, actually, I had my daughter 2019. And so 2 years after I had her, or right before she turned two, I was exercising. So my arm, after I finished exercising, I was just kind of like, stretching my arm. And so my right arm kind of got stuck in the air. So I got scared, I thought I was having stroke. I was like,
Sure.
why? So it was hurting so bad. So I was nursing it. But in my mind, I was like, if you're having stroke, it's not painful. But I just needed to figure out what's happening to me. So at the end of the day, I went to my, PCP and, they checked my blood pressure and it was, really, really high. And I couldn't understand why it was high. because at the time I thought, I'm exercising, I'm eating healthy. So why should, my blood pressure be high?
Mm-hmm.
So at the end of the day, he was like, well, we got to put you on medication. And I said, give me some time. Let me just, kind of figure this whole thing out. So, and I was still breastfeeding my daughter. And it was kind of, hard to find medication that wouldn't cross, the breast milk. So he was
Sure.
like, well, think about, stopping breastfeeding your daughter and then, come back so we can, start your med. So I finally, wean her off. And while I was still obviously, trying to figure this whole thing out, that's when I found an institution called IIN. So basically, it's an institution for integrative health nutrition, something like that. I forgot the exact name. But so I was researching them, and then I realized that, wow, a lot of people were giving a lot of, testimonies how they have been able to reverse their chronic illnesses, because of the studies that or the lessons that they got from the institute. So I was like, okay. So I called them up and I, talked to I guess the administrative, and I enrolled and I started learning about, nutrition. So my idea was just to go in, learn about it, and then, be able to help myself. But in the process, they talked about, having it as a business. I was like, I don't have time for business. I'm working. I have, 4 kids.
Yeah,
I can't do business.
I get it. I mean, yeah, it seems to be a bit overwhelming.
Eh,
But once you step your foot in the pot, it gets things going.
yes, yes. And so, and that's basically how the whole, so I went in after I graduated from it. And okay, so, just go back a little bit. When I was diagnosed with high blood pressure, so I called some of my friends and I was crying on the phone like, I can't believe I have high blood pressure. With all these things, I'm working out, I'm doing all this. And, a few of them were like, oh, welcome to the club. I have high blood pressure too. I was like, what? So, I mean, we are in our early 40s. At the time, I was 42. So, having been diagnosed with high blood pressure is almost like a club. I was like, oh, no, that's not good. And so and that's when I was like, okay, no, this is not happening because if people are having, high blood pressure at this early stage, again, remember when I was in medical school, I was in my 20s. And so people in their 40s at the time looked old. And I used to see them, they're coming with their bag of medications and all that. So now that I'm in my 40s and I'm seeing myself that I'm still vibrant, I'm still young, now it dawned on me that a lot of people are being diagnosed with high blood pressure at that age. So there has to be something going on.
Sure.
And so that's when the whole idea of starting my own business and using my story to kind of, because, a lot of times, people can identify with what you're saying because they understand your story.
Sure.
And so that's how my business, Rejuvenate Integrative Health and Wellness was born.
That is wonderful. I'm like you. I got diagnosed. I felt like it was an incidental finding because I had a sinus infection and I was working night shift. So I found someone who could see me at like 7:30 in the morning. And which
Mm,
was that's hard to do, and I'm in a medical city. So this particular clinic opened up at 7 o'clock in the morning. I was like, perfect. So I got in and he was doing an exam and he said, oh man, this is the worst sinus infection I've ever seen. I was like, gee, thanks. And in that he told me your blood pressure's up. I said, my blood pressure's up. He was like, yeah. I'm like, how? And I was like, maybe it's the stress of the infection. Maybe, it's just a precursor to all that. Well, I take to Norman for mitral valve prolapse, but I only take a half. And so he was like, you might need to get back on that because I came off because I didn't have any signs or symptoms and I was checking my blood pressure regularly. And then it's back up. So here we go again, starting from day one. So a lot of times we are walking around and we really are feeling good. And, so it came back into my mind, the silent killer. And I was like, I don't want him. I don't want none of this touching me. So I'm like you, I got to do better. So once I get over this sinus infection, I'm going to start back to walking. I'm going to start back doing what I need to do. Because when you change shifts, that changes your whole routine, not just at home,
Mm-hmm.
but your social routine, that changes everything. So I'm like you. You have to adopt a healthier living in order to have a
Mm-hmm.
healthy life.
Yeah.
Yeah. So that's where I am now. Back to exercising daily. Because before COVID, I was exercising 5, 6 days a week. It was not a big deal. But after COVID, everything changed. Everything changed. So I'm with you. And so I am watching my blood pressure and I'm back down to normal, but I'm drinking more fluids. Um, Exercising more regularly. And I've always been a decent eater, eating from all the food groups. Okay. So I don't overindulge. I'm not one of those people that has to have salt, add salt. You cook with salt, but I don't have to add salt to my food. I just think that's overkill. So just things like that. So and if it's you and I surprised that we have high blood pressure, there's somebody else out there who's going to be surprised that they have it as well.
Yeah.
so so go ahead with your integrated health.
Yeah, so the integrative health is for me is one of those again, I call it a business, but it's also a passion for me. Just knowing that with our healthcare system, okay, we call it what it is. We take our medications, but that medication that you're taking have other side effects.
It
And
does. That's
so,
true. Yeah,
and
it's
then
very
you
true. Hmm.
and you have to take, other medication to combat the side effect of the first one.
That's true.
And so before you know it, you have, you go from one medication to three to four to five, so, and then, and it's a never ending cycle. And so for me, just learning about, our body, having to heal our body from the cellular level, and if you are able to heal your body from the cellular level, all this medication, that's the goal, that you're able to, not you winning yourself, but of course, your physician, excuse me,
Hmm.
taking you off the medications. So, and that's one of the things for me is having to educate people, let them understand that food is very powerful. Food can heal you and food can also kill you. And so you choose your poison.
Oh,
Like my my trainer will tell me, every time we are doing weightlifting, he's like, pick your poison. So you pick your poison. Which one do you want? You know, sometimes we look at like certain food and you're like, man, but this food they taste so good, but yes, healthy food are also good, but you have to know how to make them taste good and not overindulge. Like I remember I went somewhere, I was doing one church in Texas. I was doing a presentation for them. They have a health and wellness event there, and so, um, I was telling them some of the ingredients that we use in Nigeria that are not really that healthy. And, one of the questions that I got was, so what else can we use? Because pretty much everybody, all household uses that same ingredient. So, and I was telling them, well, if we can learn how to start using herbs,
Mm-hmm.
you know, herbs is something that is undermined. Most people, I mean, it's something that even for me, with my own health journey, I have to learn a lot about herbs, how I can use them in my food. And they give their food, the taste that we want. And so I have to like, tell them, okay, and then, some of those herbs, you can actually grow them yourself. So you don't have to depend on the store. And you can eat like my mint. I have mint in my garden, right before fall. I have to, uproot a lot of it because I just planted just few. Before I know it, the mint is like all over the place, taking over the garden. So that's something that, I became very passionate, to kind of start teaching people. I have, a couple of my clients who are also in healthcare. I have a doctor, nurse, and, I remember when, the doctor was telling me, I feel bad that I have to tell patients to lose weight, but I'm overweight. I feel bad when I tell my patient that they need to drink enough water. I don't even drink enough water. So, again, that's what I was, saying earlier. It's what it is with our healthcare system. It's
Mm-hmm.
like it looks good on a paper. Let's tell you, do this or do that. Now, so the same thing, let's say, for example, you're telling your patient to drink water. Do you even know how much water your patient is supposed to be drinking?
Mm-hmm.
Right? So we got into that whole notion where people are like, oh, we got to drink 1 gallon of water. And I'm looking at somebody like me, if I drink 1 gallon of water, my organs and cells will be swimming in fluid.
Mm-hmm.
you know. So
Absolutely.
you have to understand how much, fluid intake that you're supposed to be taking so that you don't mess up your electrolytes, right? All in the name that you are trying to hydrate yourself. And so again, so that's what the Rejuvenate Integrative Health and Wellness does. Basically, just educating my clients and not, overwhelming them with information. And I always, go with the smaller steps, and not just me giving them the steps. They have to be the one to tell me what kind of steps, do they want to take. So let's say, for example, if they're like, yeah, I think I'm gonna, run 2 miles, in the next 2 weeks. I was like, okay, fine. So we write, I write it down. You write it down. That's your goal, to run 2 miles. But then when you come back, that after, the second week and say, you know what, I wasn't able to run 2 miles. I was able to run 1 mile. We celebrate that 1 mile because it's a huge milestone,
I agree.
that you're able to do that 1 mile. And so, then we go on next is like, okay, instead of trying to shoot for that 2 miles, now that you're able to get 1 mile, how do you feel about that 1 mile? Okay, maybe we can add 1.2 mile or 1.3, and let's see how it's gonna go for the next 2 weeks. And that's why I always look at health coaching as is individually tailored. Okay, so it's not, one size fit all. And that's, taking my time to be able to understand my clients versus, I go to my clinician, again, my PCP, and you get 5 minutes. And by the time you even think about, the questions that you want to ask, the PCP is already getting up to leave.
Yeah. I encourage my patients to write their questions down
Yes.
prior to going. I said, even if your appointment's a week off, start writing your questions down. Even if it's 3 weeks off, start writing your questions down and take them with you. Don't try to do it by memory. That
Yes.
way you can at least get your questions addressed. Because if you leave out and you haven't spoken regarding any of your issues, it's not
Mm-hmm.
it's not successful because you're
Yeah.
still frustrated because you did not get your questions answered.
Answer.
And
Yeah.
so I've been encouraging them to do that for many years, several decades. because
which is very helpful, you
well,
know.
I think so. And write your medications down before the electronic records came. Write your medications down, keep them in your wallet because every time you admit a patient to the hospital or they see their doctor, oh, doc, they're already in your chart. Well, no, they're not, especially if you saw another physician, you know.
Yeah,
And they were like, just go get the doctor's chart. I said, it's in his office. I can't just take your chart out his office. We're the hospital. It's just better if you stay informed. And I have been teaching that for so many years. And some people get it and some don't.
yeah. And just like you're saying, when I used to work in a clinic in Chicago, we used to, tell our patients, bring your medication, forget writing them down. Because you know that is, some of these patients will go to, so they have their PCP, something happened, they go to the ER or they go to the urgent care. Or when they go out of town, they go and see another doctor. And so you have all these medications that they are taking and have, in their mind, it's like, oh, well, I'm taking what, all the doctors tell me to take. So I have, I had a patient that came in. She was taking 3 beta blockers,
Wow.
and she got all of them from 3 different physicians, including her primary, care physician. And so it was so sad because like I saw, because she was my patient at the time. So, I was like looking at her medication and, again, we checked her blood pressure. Her blood pressure was really low. And so, I'm looking at her medication. I'm like, hold up. I said, are you taking all these 3? And she's like, yes. And so I asked her, where did she get them from? So she explained, she went to, ER and then went to urgent care. And so anyways, she's taking all of them. Of course, she doesn't know that they are all in the same class.
Sure.
And so I had to explain to her that this is what's going on. This is why your blood pressure is very low. This is why, you're feeling all you're dizzy and all of that. And so, again, it was a learning lesson for me and for other people to, keep encouraging our patients, especially the elderly ones. Bring all your medication, bring them all in. Let's look at them.
I
And then
agree.
I remember, yeah, and I remember another time we had this lady, she came in, not in the same clinic, but, this one was in a hospital clinic. And we did her lab work, and her lab work was showing her kidney function was going down,
Absolutely.
but she's healthy, uh but she's healthy. She has rheumatoid arthritis, and she has something. When I say she's healthy, like she looks healthy on the outside. um then she had something else that she had, but it wasn't like major health concern, but she's taking medication. But those medications, they it's not something that will destroy her kidney, anything like that. So the doctor was like, what is going on? Why is your lab work for the kidney just looking really bad, like something is going on and we don't know. So, mind you, we've read off all the medication. She told us all the medication that she was taking. And but there's not she wasn't taking anything for the rheumatoid arthritis because it wasn't as bad to prescribe anything for her. So the doctor was like, so what do you take, when you have pain? And she said, I believe she said Tylenol or some, one NSAID. But guess what? She's been taking this thing for years and she never told anybody. And this was what was messing up her kidney. And she did not know that. We didn't know that. So if it wasn't that the physician kind of, was like, okay, you're not taking it, because he kept going through like, okay, you have this disease, this is what you're taking for it. You have this one, this is what you're taking. The rheumatoid arthritis, yeah, we didn't prescribe anything for you. So when you get all these pains in your joints, what do you take for it? And that's how we realized that she was taking NSAID and she's been taking it for a while and she's taking high dose.
Mm,
Yeah. So again, part of it obviously is, taking that time, which, we as, medical doctors or clinicians, you don't have that much time to spend with your patient to start digging your brain to figure out what's going on with the patient. So we lose out on some of these things, where you have that time to sit down and like really think and said, you know what, let me look at your lab work. Let's, figure out what's going on here. The same, I remember one in another patient that I had also had I want to say it's hepatitis B or C, one of them. But he was taking medication for it. I mean, he was taking medication for it for a while. But an interesting thing was that when you know how when you go in and you write their past, medical history and all
sure.
that, along the line, somebody stopped writing the hepatitis, right? So nobody else continued with it. But then we kept looking at it, it's like, okay, why you there's a at some point in your life you were taking this medicine and he doesn't know why he was taking it. That's another thing. He couldn't remember why he was taking it. So I have to be the one, like that bothered me. And I think we did a lab, I think it was his lab work that was showing, all those abnormalities with the liver. So um, after he left, I took it upon myself to go through his report, his chart.
Sure.
And I went all the way from the beginning when he came to to that clinic. And I'm going through it. I'm going through it. And then bingo, found it. So again, is that I don't know if it's the compassion or or I
Well,
mean maybe there's still that compassion, but there's no time. There's no time for the physicians to, stop and say, let's look and see what else could be going on.
and I agree with you. And like I say, when I was asking them to write down their medications, I
Mhm.
wanted them to write down the name, the dosage, how many times a day they took it. Um, and that's all of it. We need to know.
Mhm.
And then there are those patients that will bring in not just a small bag of medicines. They bring in this big bag. And the doctor went, no way, no way you're taking all of this medicine. But what she did was really kind of smart. She brought it all. She brought it
Mhm.
all. No, I don't, but I want you to know that this is what I'm on. So he had to take the time. He put on his gloves, pulled out bottle by bottle. And, but it takes that sometime to get your patient on the right track. Like you said with the NSAIDs, um, some people take medicine for so long they forget they're taking it. Okay. It's just that much of
Mhm.
a routine. I had a patient, she told me, oh, my doctor forgot to write my Valium. And I was like, okay, I'll talk to him about it. Well, when I talked to him about it, he said, I don't want her to have it. So I was like, he knew her very well. And so she went, when I told her, he said that he'll come back. He's not sure if he really wants you to have it. I gave her the truth, but I added a little bit more to it to keep me out of the middle. And so she told me, I have been taking it so long, I needed to go to sleep. And she said, one
Mm.
night, you're not supposed to be taking Valium with alcohol. I was like,
Alcohol.
she said, well, I had just went to a dinner party and I had some wine. So I came home and I took my Valium. I said, how'd
Ooh.
you do? She said, I did fine. But that's just how much of a routine she was in.
Mm.
Okay. So you're just like, I mean, we're all human. We make errors. Okay. I've had patients, they put their little cup of medicine next to their husband's cup of medicine. She gets busy doing things and she takes his and he takes hers. And so his medication bottomed out her blood pressure because she does not have a diagnosis of hypertension. He does. So she came in the hospital. They said that she overdosed, and I went in and looked at her. I said, "That's not an overdose. That's not. This woman did not overdose." Okay. And so when I got an opportunity to speak with her, she told me exactly what happened. It is such a believable story because we can all do it. And she said, now I just hope my estrogen doesn't make him start growing boobs. She had a very good outlook, you know, on what's going on. And she said, but his medicine, that is why I'm in here. It dropped my pressure. And she said, I just do this every night. But he took his, I didn't look in it after I prepared him. We just took our medicine. And here I am in the hospital. And it was not an overdose. It was, she just mistakenly took the wrong med. So I don't declare that an overdose. Okay. And so when the
Yeah.
psych came in and talked with her, he had as big a laugh as me and you had because she was such a vibrant woman. And she said, I will be careful from here on. His is either going on his side of the bed and mine going on my side, but I got to come up with a different plan. So we have to, anything can happen, mistakes happen, but
Mhm.
I am glad that we are on the same network with medications. Who's prescribed what when? That does help your physician, your PCP, your specialist. Everyone then gets a chance to know just what's going on. So that technology has really, to me, you know, helped with some of that. But you still need to be honest in what you're taking.
Yes.
Because if you
Yes.
go to urgent care, you still need to be honest in what you're taking because you
Mm-hmm.
don't want medicine like we were saying. You're on 3 beta blockers. How
Yeah.
did that happen? And when I'm on the outside looking in, how did that happen?
Mm-hmm.
And it's just by the grace of God, it didn't have a horrible effect on her.
Right.
Okay.
Yeah.
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 So
Yeah.
that's why this information is very important to people. It's okay. If you have a physician you can't talk to, you need to find a different physician.
Exactly.
You need to find a different physician. But and I tell everyone, you have to advocate for yourself. Yeah, you have to ask the
Definitely.
big questions. Don't, and I hate to use the word dictate, but you have to ask questions for yourself, for your health, for your well-being. And it's okay to ask questions. That's why you're there because they will always end this exam with what questions do you have?
Yes.
And most people will say, I'm okay, I don't have any. But you really do.
Do. Yeah.
And it's okay to ask because
Mm-hmm.
they can't help you if you don't tell them.
Yes.
Yeah,
Yes.
no matter how busy they seem to be, that's not your thing. Your concern is to be concerned about yourself
That's
or the loved one that you're with, if that's the case. Okay.
true. Mm-hmm.
So that can happen. It has happened, but we have to constantly tell people, you need to help us help you.
Yes. So true.
Okay. So with your health and wellness,
Mm-hmm.
you I saw your pictures where you're exercising. It reminded me of me when I was in the gym before COVID. But I'm like, she getting down. So do you have a personal trainer or do you exercise on your own?
So for years I've been exercising on my own. I
Hmm.
just got a personal trainer August of
Okay.
last year.
Hmm.
Yeah, so I got to the point, where I was like, you know what? I am, I'm 46. I turned 46 last year, July.
Okay.
And I know that, I've been working out over since I was about 19 years old. And so it's been a lifestyle for me.
Hmm.
But I know that as you're aging, you start to lose muscle.
Hmm.
And so I needed to do something different. So I was like, I needed to go and get a trainer. And the trainer obviously will help me, learn how to, because and some people will say, "Oh, why a trainer? I mean, know how to work out. You in the Navy, blah blah blah." But so one thing I always say, if I am training myself, I can lift 10 pounds. But having a trainer makes me lift 20 pounds.
Mm-hmm.
And in my mouth, like, oh, I did that, but on my own, I will not try that. So it's like, I'm lifting weight. If it's too heavy, I reduce them. But with a trainer, it's like, no, you're being challenged to push yourself.
Mm-hmm.
And I noticed myself, getting stronger and stronger, as I'm working out with the trainer.
Mm-hmm.
So that's something for me, yes, it's a little bit of, money that comes out of my pocket.
Mm-hmm.
But like I always tell my clients, you either pay now or you pay later. So
That's
yeah,
true.
enjoy it. I enjoy going there. And another thing also is I'm one of those people that I don't waste money. And you know how some people say they pay for gym membership and then they never go. Oh, that would not fly in my book.
Mine either. No,
I
I'm
pay
not
for.
gonna. I'm not gonna throw the money away. No, I'm
I
gonna
am
use it.
not. So I will go, and that's why even when I don't feel like going, but knowing that if I don't go today, that means I'm gonna miss out on my whole training day. So yep, I'm getting up. I'm going.
I
Okay,
agree.
mind you, I mean, yes, maybe once or twice I'm like, okay, um, I need to sleep. My body's telling me that I need to relax, and then I just, go to bed. But 98 out of 100, I am in the gym, getting my money's worth.
Oh, that's great. That's great. Yeah. I'm with you. Um, I had a hypertensive episode not long ago, and I
Mhm.
was like, wow, what am I not doing? Well, when I look at it, I wasn't doing anything that I was doing prior. The water intake, I had I was just drinking enough water to get by when at one time I was at a nice level of water. Okay. Um, I wasn't exercising like I normally do. Um, and I was like, okay, you got to get back. You've got to get back to all of it. You've got to decrease the amount of sugar that you're taking in. You've got to do it all over again. And I just made that commitment to myself. Now, I would go in there 2 days a week. Yeah. But see, when you go 2 days a week, when I was going 5 days a week, what are you doing the other three? And you just have to be honest with yourself. So now I don't care. I have a little trampoline, one of those mini trampolines at home. So when I can't get out, like today, it's such a rainy day, that mini trampoline is coming out. I'm jumping up on it. And in fact, I used it yesterday. So there is something you can do. If you can't walk, there is something you can do. And I have my weights here because I started in college doing weights and fell in love with it, okay? And when I realized I was getting a little bit too buffed, I was like, oh, wait a minute, let me back up. Because you can see my guns coming, okay? You can see my gun. I was like, wow, but when you like something, you like it. When it fits you, it fits you. I'm not saying weights are for everybody. I'm not saying that. But I do encourage people what you can do, you need to do it. I don't care if it's that little mini cycle or if it's walking. And, some people have walking limitations. They can't walk. I get that, but do whatever you can do to stay active because it's not just about your legs, it's about your heart,
Hmm. Your
so because
heart, your mind.
yeah, it is. But, I think about I'm cardiac. I've done a lot of cardiac in my nursing career. Just basically all forms of cardiac. And I'm like, no, we need to do better with that. And seeing that cholesterol, you just need to do better than what we're doing. And you can. You can.
And yes, yes. And so, just piggybacking on what you are saying. with when it comes to health and wellness or health, for me, I always tell my client that it's a journey, it's not an overnight,
It is a journey. It is a journey.
so it's something that you have to start slowly. We can't just, change our refrigerator overnight. We can't change our pantry overnight, but it's something that you slowly start to look at, what is benefiting you and what is not benefiting you. What are the things that make you feel good? And what are the things that make you feel sluggish? And so from there you start to like they will tell us in our health coaching institute, it's like you're crowding out, so you're adding things and then you're letting things go. And so those are for me, also, like, one of the things I always try to do with my clients is to let them understand their why. Okay, so you have, like, I have, remember one of my clients, she used to eat a lot of Chick-fil-A. And so when we started talking about she did detox, and, we kind of, talked a bit about the whole Chick-fil-A thing. And she was like, after she did detox, multiple times, she's like, oh, she stopped having that craving for Chick-fil-A. So again, I did not tell her to stop. I just, educated her
Sure.
on the whole thing. And and one of the things, like, I have, one of my friend, she talked about her husband that, had cancer, but even though the doctor gave him, I think, like 6 months or so, he
Hmm.
ended up, living like 3 or 4 years because they made a lot of changes in their health, in their diet. But, she was saying that her husband, when you see him, because I saw the picture, I didn't meet him when he was still alive. He was skinny guy. He walked out, he was also in the Air Force, and he was a pilot. And so she was like, yeah, he would go and work out and do all of this, do the quote unquote the healthy things. But what he would do is that after he work out, he would go and eat McDonald's or Burger King, because in his mind, it's like, well, I've already worked out, so like, there's no harm to eat all this, without realizing, when you work out, quote unquote, your whole body, your cells, they are pretty much in a state of, I need food, I need food, I need you to feed me,
Hmm.
but I need you to feed me the right things.
Hmm.
Right. So, that's where you have, again, in medicine, you have that stress, again, those stress levels are up because you work out,
Sure.
right? But now you got to calm them down. And that's one of the reasons why, when you work out, there's certain food that you're supposed to eat. And those food are to nourish those muscles, those cells that have been activated, and to make sure that, again, you are putting them in the right path. But, when you go in and you are eating McDonald's, Burger King, all these fast food that has all this inflammation,
Hmm.
your cell is already inflamed because you worked out.
Hmm.
Now you are eating all these fast food that also has, causes inflammation. You
Hmm.
are double whipping or triple or quadrupling the stress level, the inflammation, in your body. And so, and that's one thing that people don't understand. People think, I work out, I eat whatever I want to eat. That is a good idea. You can eat whatever you want to eat, but you have to make sure that you are feeding your body the right thing.
I agree.
There was a time that I used to see on like YouTube ads. This guy will say, I work out, I eat pizza, I eat burger, I eat this. And I was like, wow. I
Hmm.
haven't seen it in a while now, so I don't know if somebody shut him down or something. But that is the wrong message that you are sending out to people,
I
you
agree. It is the wrong message. Mm,
know.
yeah.
So those are the things that, again, like you talked about sugar, one of the things, in fact, I'm reading a book it talks about sugar. Let me see what's the name of that book. Just brought out. Oh, the case against sugar.
Mm-hmm.
And one of the things about sugar that people don't understand is that cancer loves sugar.
Mm-hmm.
So cancer thrive in sugar, and that's why, when they try to find, cancer, they put a PET scan. What does the PET scan has in it? Glucose, because cancer will glue up, when once they are attached to sugar.
Mm-hmm.
And so now I I see people when they are diagnosed with cancer and they are going through their chemo and radiation and whatever else that is going on. And and whoever the clinicians or will tell them, eat whatever your body wants you to eat, because you are going through a lot. Your body's going through a lot, you're but what does our body want? Sugar.
Of course.
And so I'm seeing these people going through chemo and radiation, and they are drinking soda and they are eating all this, sugary food, because that's what their body wants,
That's what it's craving. Mm-hmm.
you know. And I'm like, I'm sitting there like, wow, this is sad, because on the other hand, you are giving them chemo to try to kill kill this disease, and then you have them feeding it. Right.
Yes.
So, in my mind, I was like, wow, we need to really learn how to educate our, people, educate people, let them know. But again, it's not a fault. Again, I don't know about nursing school. I know for medical school, we did not have any training on nutrition. So if you want to know anything about nutrition, you have to go outside of your medical training to
That
learn
is
more
true.
about it,
That
you
is
know.
true.
So,
Okay.
and that's one of the things, for me that is always like, we got to, find a way to do better. I know in my health coaching training, it was like, yeah, you can work with doctors and see, but a lot of times, you can really, not a lot of doctors are receptive, to have a health coach come and work with their patients. Because if your patient get better, they lose, patients, right?
Yeah.
I remember
Yeah.
when I did I did observership in one hospital in Alabama. So that I cannot remember the name of the doctor. I was there for like I think 2 weeks or so. And the doctor, I went in and saw his patient, and the patient was overweight. And so, and then you can tell that most of her issues are coming because of the weight. And so I wrote down my own little notes, went back, presented the whole thing to the, physician. And one of the things that I recommended was to educate her on, weight loss and, exercise, what her food intake, all of that whole nine yards. And so he went and talked to the patient, did whatever he did with the patient, came out. And I said, "Oh, doc, you forgot to tell her about her weight." And he looked at me and said, "Do you think she doesn't know that she's overweight?" And I was like, okay. He's like, she knows she's overweight. So if I tell her about losing weight and then she go and lose weight, then I lose a patient.
Mhm. Yeah, but
So they,
if you really care about the patient, you're going to tell them the truth. And I have been around doctors that are really honest. So when I hear these stories, I'll be like, where'd that come from? But it's
Mhm.
like you say, you don't get a lot of nutrition in nursing school, but we did have to take a class from one of the nutritionalists, and it was basically mandatory. Um, and they go over it, but it's not detailed. That's why you become friends with a dietitian. you know, you become friends with your dietitian, and I ask a lot of questions. Why this with this? And she was very, very good. Renee was very good at explaining things and giving me her time because I do want to know. Because when you come in and you talk to the patient, I will follow her, especially if it was my patient. I followed her into the room and she would talk to them about it and, be as thorough as she could and be as simple as she could with it. And, when she leaves out, the patient tell me I ain't listening to nothing she got to say. I'm gonna eat this. I'm like, okay, but and that's a fight because
Mhm.
people want to eat what they enjoy. And I'm
Yes.
saying you can't, it's not that you can't have it, just you
Mhm.
eat it in moderation.
Yes. Yes.
I'm not gonna tell you can't have that Snicker. I'm just saying you don't need one every day. Okay. Yeah, I'm not gonna tell
Yeah.
you that. But can you tell us about your celery? I want to know about your celery.
Oh, yes. I knew I was forgetting that book.
No,
So
I
anyway,
wasn't. I wasn't gonna let you forget.
I celery juice journey, I want to say maybe 3 years ago or so. And I had it was this guy, he's medical medium. His name is, I think, Daniel. I want to go on my Instagram real quick so I can pull out his name. But it was, it was actually a friend of mine that was, talking about him. And, well, she had a book. So she was reading the book. And I was like, oh, okay, this is interesting. And so I went and got the book and I'm reading it. So the book was about celery. And he talked about how the celery has changed his life and has changed, so many people's life. And I was like, celery? I barely even eat celery by itself.
I'm with
Like,
you.
how am I gonna drink it?
Mm,
You know? So yeah, he's on Instagram. His name is Medical Medium.
mm,
Um, yeah. So it is I mean, I was like, okay, I'm gonna try it out. So I tried it first time, like maybe did like a 7 day, celery juice. I was like, okay, this is an acquired taste, because there's nothing sweet about celery.
at all.
So from there, I was like, okay. So I got the idea. Now what I've learned that, it's almost like the celery is like the Bible of the health, quote
Mm-hmm.
unquote. So many people have talked about how they have been cured from, all kinds of, diseases, because of the celery juice. And so to start it off, you wake up in the morning, like I tell my clients, you don't need to brush your teeth, you just use water, rinse your mouth, and then make the celery juice. So make yours done by the store made one. So make it fresh every day, because when you make it and put it in the fridge, the next day the potency kind of decreased. And I've noticed that because I did it because I wanted to try it out, and the taste was different. So now I started making my own celery juice every day. So basically, what you do, again, you drink it, you can start off, like 8 ounces, which is what I did. I started off with about 8 ounces. Now I drink about 16 ounces. So you drink it and then you wait about 30 minutes to an hour before you start eating anything. If you're a breakfast eater, or, if you drink coffee, whatever, just, wait. And the whole idea is, drinking that juice, it goes into your small intestine, diffuse inside your and diffuse into your blood vessels, and then go into your liver, cleans out your gut, and then of course and that's a part of the detox, because most of the time you find yourself going to the toilet,
Mm-hmm.
so you move out all the junks coming out. So, and that's, so, and there's a lot of benefits, then that's why, like right now, we are doing a 31 day. I put out a challenge on my social media to join me and do a 31 day, celery juice challenge. And that's basically what we are doing. So you wake up in the morning, you make the celery, you make your celery juice, drink it, and then wait about 30 to an hour before you eat. And, and a lot of people have said, they felt good. I remember last year when I did it, somebody told me that she used to have pains on her joints, and she realized that during that, period, her pain went away. you know One of the things that I get a lot, with my friends are like, they always talk about my skin glowing. Of course, it's not just celery juice that I do. I take other plant-based, supplements and things of that nature. So I try to, again, try to keep myself, healthy as much as I can. So, those are things that I see, for me, with my skin, the energy, I notice also, it helps to stabilize my blood pressure. Again, remember, I also said that it's not just the celery juice that I'm doing a whole lot other things.
Mm-hmm.
So, it's for me, it's like any little bit of things that I'm adding, the goal is to help, heal my cells. So that's the whole thing about the celery juice. So, like I was telling my clients, it's not just a one-time thing. It's something that, like let's say the 30-day or 31-day, challenge. I try to do it maybe every quarter, but every month I try to do like maybe 7 days.
Okay. That
Seven
was going
days.
to be the question I was going to ask you. How often? Once you get started. So you do it once a month for 7 days.
Yeah. Mm-hmm. Yeah, and then sometimes I do more than that. It all depends on how I'm feeling. I might go to the store and I'm like, oh, the celery is on sale, and then I, gather a bunch of them, and then it's not just the celery juice that I do. Also, sometimes I will add, green apple, or I add pineapple to it. I will do, again. I put in, like, let's say if I'm not doing celery juice, because the celery juice is just pure celery, nothing else. But when I do, when I want to do like some kind of green, juice, I have mint, I have parsley, what else? Green apple, maybe, red apple if I have them. I also, add pineapple, but I put a lot of ginger because I always like, ginger to kind of help, get all the inflammation and whatever else that, ginger does in the body,
Mm-hmm.
get them all in. And so those are the things that, I also do with the celery. So it's not just, pure celery juice. I also, do other things on the side.
Okay, that was going to be my second question because I am really sensitive. I'm like you. I don't really eat celery. I'll chop it up and put it in certain things, dishes that needs to go in, but I'm not that girl. I don't like the taste of it, but it gives it good flavor. So I was like, well, I wonder, can I add something to it? Okay. So you've answered both my questions on that. I might give it a try. I promise. I'm really thinking real hard on giving it a try.
And one thing else that, like somebody sent me a message and said, can she add something in it? And I said, yeah, sure, you can add maybe green apple.
Mhm.
That's about it, just because that will give you just a little bit of, sugar if that's what you're looking for.
Now I'm looking for
Um,
taste. I need to be able to.
yeah.
I need to be able to
So
swallow it.
I know it was interesting. I had my 11-year-old actually did it with me last year. At the time he was 10. So I had him do a full 30 day. It was an interesting idea. It's like, I have to get the juice ready as soon as he wakes up in the morning to go to school. So, as soon as he wakes up, he comes downstairs, he, drinks it, and then go and shower. By the time he get ready, the 30 minutes have already passed, so he can eat breakfast. So this time around, I wanted him to do. He's like, Mom, I tried it that time and I was able to complete my 30 days. It's like, I don't want to do it again. But the one thing that I was telling him, he used to have really bad eczema. Since he was born, he had really, really bad eczema. And of course, we've done a lot of changes, to our diet and all that. But I noticed that after we did the whole 30-day, celery juice challenge, his eczema cleared up till today. There's not a single eczema on him.
Oh, that's great.
Yes. So that's what I used to. I will bribe him and say, "Oh, remember, your eczema when I wear." He's like, and they are not coming back.
He is speaking that into existence. That is right. But he knows what to do if it ever flares back up again. But that's wonderful. That is wonderful. Well, Dr. ChiChi, I want thank you so much for being with us on Gentry's journey. I've thoroughly enjoyed it. But tell
Yes.
the listeners how they can find you and find your products, your tips on exercise and things of that nature.
All right. So on social media, so that's Instagram, TikTok, Facebook, I am ChiChi Health. So again, ChiChi Health. CHI, the word health. My website is rejuvenateinhealth.com, rejuvenateinhealth.com. Or if you go on my social media, share my Instagram, if you go on the bio section, you will see my link, and then you just click from there. Also on my website, you can also see I have their 21-day Love Your Health. Again, is I'm always having some kind of little challenge, but it was a challenge that I did last year.
Mm,
I did it for spring, I did it for summer, and I did it for fall. And so it's almost similar thing. But if you go there, it's free. It's a PDF, so it's a 21-day Love Your Health. It has like different things that you can do for 21 days. Like it gives you idea on food, action plans, gratitude, things of that nature. That is not tedious, but it's just a small step. And people that followed me last year that did it multiple times with me really loved it. They also love the idea that they can make simple food that has a lot of nutrition in it. So that's something that, again, if you go on my website, you can get it. I also co-authored a lot of books that are also on the website. One of them, which I co-authored with Ms. Carolyn Coleman, is She Said Yes to Herself, unapologetically. I also talk about a bit about my journey there. My latest book that I really have been getting a lot of comments on is my 30-day wellness journey,
okay.
mindfulness, gratitude, and growth. And it's also on the website.
Okay.
So these, when you look at it, you see like pictures that I took. Those pictures are, either when I was walking or flying because I travel a lot. So I was just, taking those pictures, not even thinking anything of them until when the idea to write the book came in. And, God was like, yep, this is where those pictures are going to.
That's
And
great.
yeah, so I said, so it's a really, really great journal. So it's a 30-day, you have Bible verses on every day. You have an intention, so some things, for you to be intentional about for that day, and also reflections. And you get to journal your thoughts.
Okay.
Okay, so again, those are the things that people have been very, very excited about, just to have Bible verses that will help them for the day.
That sounds great. Thank you again. I am going to try the celery juicing mixed with apple or pineapple, guys. I mean, I'm going to go ahead and confess. That's how I'm going to start it off. And I am going to, but I'm not, I think I have a date in mind that I'm going to start it. Um,
Okay, okay.
yeah, and it's going to be for Lent, okay?
Oh, nice.
Yeah, it's gonna be for
Okay,
Lent because yeah, so that I think that'd be a perfect time to,
okay,
to get
okay.
this party started, okay? Because I usually
Yes,
do
please.
something for Lent, and so
Mm-hmm.
I might as well try the celery and let's see what it do for me.
And let me know how it's going.
Oh, I most
Let me
certainly
know.
will. No, I will definitely keep you in the loop on how that is going to
Yes.
work out. Okay. That is
And then
right.
I have people that what they are doing now is like they're sending me pictures, and it's kind of like a way for them to be accountable for
Mm-hmm.
themselves, just to say, okay, I took it today, and she's expecting my picture, and so they are sending me pictures to kind of keep themselves accountable. So
So they do
yes,
it, they send it every day to let you know that they're drinking the juice. Okay. Well, I
yes,
might not send you one every day, but I'm gonna send you one every week. I'm gonna let you know because I'm going to
okay,
incorporate it, but I think that will be the perfect time because I think Lent comes early this year. So that's
okay,
what I'm gonna do. So
all
thank you
right.
so much. I have truly enjoyed it. You have a wonderful day, a wonderful
You
weekend, and
too.
I will keep you up on my journey, okay?
All right,
All right,
thank
thank
you.
you.
All right, bye.
Bye-bye.